here is your question. Right, so if you have read and understood, considering your surgical anatomy station, kindly please tell me about this area that you're looking at.
That's a triangular.
These triangles of neck. All right, can you please tell me how would you divide the triangles of the neck?
Yes, it's divided by two large triangles, anterior one and the posterior one,
Very good.
by the sternomastoid muscle.
Yes. Into
and the
anterior and posterior triangles. Very good. How many triangles there are anteriorly?
anteriorly, we have 4 triangles.
Yes. How are these divided? Which muscles are dividing them?
The digastric muscle.
Yes. Which belly?
And the digastric muscle, both bellies, and
Yes.
the superior belly of omohyoid.
All right. Can you identify this image is numbered. Can you identify which muscle are we talking about? Is it 1, this one, or is it 12, this one, or is it 9, this one? Can you identify which muscles?
Yes, 1, it's posterior belly of digastric muscle.
Very good. And 12?
12, it's anterior belly.
Very good. And 9, please?
9 is the superior belly of omohyoid.
Very nice. Excellent. Can you please tell me which triangle is this, number 13?
Number 13 is the digastric triangle.
What are the contents of anterior triangles? All 4 of them, please. Quickly.
All of the anterior triangle?
Yes, the contents of the anterior triangle in all four triangles anteriorly. If you can, where is my cursor? Yes, if you can please tell me what are the contents here, 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 and here. All these 4 triangles anteriorly, what are their contents?
Yes, the gastric triangle, we have the submandibular gland.
Yes, very good.
Yes, and the facial artery and
yes, very good.
lingual nerve.
Yes.
Then submandibular lymph nodes.
Very good. And all right. If you can tell me, for submandibular gland we are talking about, what are the 3 nerves which pass through it?
Lingual nerve.
And?
Hypoglossal nerve.
And one more, please.
Yes,
okay, we'll come back to this one later. When you cannot answer, then say I'll come back to this question later. All right. If you can please tell me what type of secretions are secreted by the submandibular gland?
Secrete saliva.
Mixed
secretion.
Right.
Mostly.
Can you please tell me the surface marking of facial artery?
Surface marking facial artery.
Yes, please.
No, we will come to this back later.
All right. Okay. If you ligate facial artery, then you'll end up with the necrosis of which muscle? Ligating facial artery will result in necrosis of one muscle. Which one, please?
Facial artery. It's no.
All right, we'll come back to that one later. Can you please tell me, this is which muscle is this?
This sternomastoid muscle.
Very good. It is also dividing anterior triangle into anterior and posterior. How many posterior triangles are there?
There are two posterior triangles.
Yes,
divided
please. How are they divided?
by the posterior belly of omohyoid.
Yes. And which muscle is this? Number 5?
This inferior belly of omohyoid.
Yes. And what about this muscle? 6, please.
6, it's the trapezius muscle.
Very good. All right. What are the contents of the posterior triangle as a whole?
Posterior triangle, it have accessory nerve.
Yes.
And
all right, we'll come back to that one later. If you can identify, if you're looking at this image, kindly please tell me what this F is.
F, it's a thyroid gland.
Thyroid gland, very good. What is E?
E, it's the isthmus of thyroid gland.
Isthmus of thyroid gland, yes, very good. Can you tell me how would you describe the anatomy of the thyroid gland? What are the parts of the thyroid gland?
It have two pyramidal lobes,
very good.
Right and left, and
yes.
Connected together by isthmus.
Yes, very good. Can you please tell me the blood supply of the thyroid gland?
Blood supply, the arterial supply is the superior thyroid artery and inferior thyroid artery.
And
the thyroid ema artery.
Very good. What about the venous drainage?
Venous drainage, it's superior and middle and inferior thyroid arteries, thyroid veins.
All right, very good. Can you identify this structure number C, please?
Number C, it's maybe external carotid artery.
Very good. Can you please tell me what nerve passes just anterior to it?
The vagus nerve.
Very nice. Very good. Excellent. Moving on, if you can identify this blue number 11.
Number 11, it's internal jugular vein.
Very nice. Very good. Excellent. Can you tell me the surface marking of it, please?
Surface marking, it's the upper, we will draw a line between two points.
Yes.
The first point is the point connecting between the upper 2/3 of sternomastoid and lower 1/3 of sternomastoid.
Yes.
And the other will be the point between the upper third of trapezius and the lower 1/3 of trapezius, upper 2/3.
What is the significance of knowing the surface marking of this structure number 11?
Because it's commonly used to insert central venous line.
Very good, excellent. Can you identify which structure is this blue one?
Blue one, it's trachea.
Trachea, very nice, excellent. This 16, 9 and is it 9 or 5? 5 and 16.
16 is thyroid gland and
yes. How many? Yes. What is the posterior relation of the thyroid gland, please?
Posterior relation, it's parathyroid glands.
Yes. How many are they in number?
They are 4.
Very good. Excellent. Right. Bell has gone, but one last question that I wanted to ask you. If you can tell me, yes, how how this thyroid gland moves with deglutition. Why?
It's move up and down with deglutition.
Yes. Why?
Because it's enclosed in the pretracheal fascia.
Very good. Excellent. Yes. Because of that. Yes.
Yes.
If you want, you can complete your sentence.
Yes, because pretracheal fascia is connected to the fascia of the neck.
Yes.
and move up and down with deglutition and muscles of
Investigation. Very good. Excellent. Good.